Welcome to The Simple Show. Today's topic, dementia. We are here with Dr. Heinz Luescher. So let's go. Can you explain in very simple terms what is dementia?
Well, dementia is a disease for elderly people. The most obvious is that these people forget almost everything, and it's a destruction of the brain. You can't remember, you don't find your way home, and so on. So it's very difficult for the patients to accept.
How many people suffer from dementia? Do we have any statistics on this?
You can imagine about 10% of all the seniors suffer from it, and about 30% of all the elderly is over 85.
And it gets worse as the older the people get. I see it, 65 people years old, and then once you hit your 85s, your 95s,
right.
There's a strong increase.
So when you're forgetful at the age of 65, you will be totally in dementia at 80.
Okay.
And need care.
Wow. Okay.
It's in the care homes, it's more than 30%. It depends, but it's 30 to 50%.
Okay. Can you talk a little bit about the differences of dementia? So I read that we talk about primary and secondary dementia. Primary dementia comes, from the loss of nerve cells, and the secondary dementia comes from, sicknesses that you've had before. That could be viral sicknesses, thyroid gland sicknesses. What's the difference here?
Well, it's just an academic difference. See, for the patients, it doesn't matter. You lose your brain, you lose your memory. It doesn't matter what the cause was. See, at the end, brain cells are dying, and the more brain cells you lose, the more forgetful you get. See? And the brain doesn't care if you lose your cells because of Alzheimer, or because of arteriosclerotic vessels, or of any other.
So what leads to this degeneration of the nerve cells? What leads to this?
Each cell of our body produces energy. That's happening in the mitochondria. See, a brain cell contains 10,000 mitochondria. This is the most complicated cells we have, is our brain cells. And in these mitochondria, the energy is developed or built. See? But that this can happen, we need all the ingredients. See? So the ingredients come from our nutrition. What we are eating at the end is feeding our brain cells. And when your eating habits are bad for 30, 40 years, imagine how weak these brain cells will be one day, because they don't have the material to build energy. And once it happens that they die. Yeah. So you lose brain cells every day. Brain cells are not replaceable.
So that leads to the next question of what can I do, or what can one do to get ready to prevent dementia? It must have something to do with protect your brain cells.
Yeah, exactly.
How do you do that?
Well, the first thing is eat properly. See, it's we eat too much sugar. We eat too much carbohydrates, and we eat too little veggies. That's simple. And so that's the first thing. See? A good nutrition, good eating habits. Because a dementia is not coming in a year or two, so it takes 30, 40 years to develop. See? That's why it's a disease of elderly people. Usually comes after retirement.
And what role do supplements and micronutrients play in this? So you say just eat well, eat healthy, and then you should be good?
Well, if you're really eating vegetables, salads, fish, all the important stuff, if you eat that every day in a good amount, then I think you're pretty safe. But who does that? The majority of people prefers donuts and Coke and all that stuff that it's lacking all the important micronutrients. And so if your eating habits are not according to biology, then I suggest supplements.
So that's the prevention side of things. Now, once somebody does have dementia, maybe second stage, kind of getting into that really forgetfulness phase, do you still have an answer for that phase as well? Or is it just something you can do beforehand, prevent, but once you kind of get into that phase, do you still have an answer there?
Yes, there are 3 stadiums of development. So stadium 1 is easy forgetfulness and you don't find the words. Stadium 2 then is already disorientation. These people don't find their way home or things like that. And phase 3 is terrible. This is just, these people are like, the brain is almost dead. So these people sit in their chair and don't respond when you call. And so that's too late. In this stage, nobody can improve anything. But in the first 2 stages, it's possible to improve. It's not possible to heal it, but to improve so that these people are still able to live at home and help themselves. So, but it's not easy, I tell you. We need a lot of important micronutrients.
Okay. So let's pause right here, and in the next interview session that we will do, let's talk about what exactly we can do for that phase, prevention plus phase 2. Thanks for watching. See you later.